when health is absent. Wisdom cannot reveal itself. Art cannot manifest. Strength cannot fight. Wealth becomes useless, and intelligence cannot be applied. FBSN presents The Health Wave. Maximum information for making wise health and lifestyle decisions.
Once upon a time, there was a young lady who developed a health condition that made her unable to have children. And all the OBGYN specialists that she turned to concluded that she might be developing cancer. But after testing, numerous testings, cancer never showed up. And however, the medications that she was offered also didn't work. This went on for 5 years, until one day she met a Chinese medicine practitioner. She shared her problem, and the Chinese medicine practitioner said, "Please come to see me. I'll fix your problem." 100% skeptical, totally skeptical, the lady went to see this specialist. To make a long story short, 3 weeks later, after 2 sessions of needle treatments and 3 weeks of taking Chinese herbs, concoctions, very bad tasting herbs, the problem was resolved. A few years later, she gave birth to a wonderful, beautiful miracle child. This lady is speaking to you right now, and her medical doctor is sitting on the other end of this connection in Madison, Wisconsin. Welcome to the Health Wave, and let me introduce my special guest, a licensed acupuncturist, a specialist who has over 35 years of experience, who holds a master's degree in traditional Asian medicine, Leslie Koff. Hi, Leslie.
Hi, Victoria.
Welcome to the Health Wave.
Thank you for having me as your guest.
Thank you for being with me again. Last week we did a segment on herbs, and it was a hit. Everybody liked it. I had a lot of great responses. But today I would like to speak with you about Chinese medicine, your very specialty. So Chinese herbs cannot be talked about without speaking about Chinese medicine. And the earliest written record of Chinese medicine date back to 5,000 years ago. And now today it becomes more and more popular. It turned into an industry with 40,000 licensed practitioners and more than 380 million patients every year. So clearly it is becoming popular in the United States. However, it still overcomes certain difficulties, trying to overcome, like closed-minded skepticism, some stale cliche, unhelpful myths, just simply because traditional Chinese medicine comes from philosophy that's different, sometimes oppositional to the accepted Western wisdom. Isn't that so?
This is true. I think the bigger problem of traditional Chinese medicine is that people just don't understand it. And a lot of times we reject what we don't understand.
But we don't understand it because of lack of information.
Right. So I understood very early, 35 years ago, that it was my job to educate people as well as help them.
So let's do it now.
Okay.
So what are some of the fundamental differences between Western and Eastern philosophy, Western and Eastern medicine?
There is I think, a pretty big one that I'd like to focus on. When you have a problem in your ear and you have headaches, then your Western medical physician we'll send you to an oh my goodness, I can't say the word, an ear doctor. And we'll also send you to a specialist for your headaches. But in traditional Chinese medicine, these two different symptoms are seen as part of the same pattern. So, whereas traditional Chinese medicine seems the different organs of the body and the body as a whole as a process where each thing affects another thing, but it's all part of the same machinery, if you will. Then in traditional Western medicine, it's seen as every different part requires a different specialist and things are seen independently, whereas a traditional Chinese practitioner will say, oh my goodness, these are related because X, Y, and Z.
That's the main difference.
Otolaryngology, oh my goodness, I still can't say the word. Forgive me.
I'm not even going to try to say it. Otolaryngology. See?
Laryngology, yeah, okay. Next.
So, well, Chinese medicine also lies in a saying, a person is sick not when he has a disease, but a disease occurs when the person is sick, which essentially brings us to the question that often rises in our HealthWave program. What is first? What is primary? Psychological health, emotional health, or physical health?
That's a great question. One actually rises from the other. I'll explain. Think of a rose bush, and you have a rose bush in your garden, and you're watering it, and it's getting sunshine, and it is healthy, and then it buds, and then it blooms, and the rose is gorgeous because it has been getting sun and it has been getting water. Your physical health is the actual rose bush. Your psychological health is the rose, is the flower. So if we're not caring for ourselves physically, think of watering a plant, feeding a plant, giving the plant sunshine, then our rose, if you will, our flowering will be less than beautiful. It will be wilted, it will be just wrong, and this manifests as psychological health that isn't quite what we want it to be.
By the way, you look like a beautiful rose today. I must compliment you.
Thank you.
An interesting fact, in the Republic of China, more than 440,000 of medical institutions provide traditional treatments. Did you know that? Which actually includes 90% of hospitals that offer traditional Chinese medicine. And what's more interesting, that health insurance pays for all of it. And everyone has to have health insurance. It's an obligation. Isn't it interesting?
Very interesting.
Here it's a completely different situation. We get sick, we go to a regular doctor, and then if they can't figure out what's going on, then we may consider going to a Chinese doctor or an acupuncturist, someone like that. But I think simply we don't even know if we can be helped by this practitioner, but we just in case we decide to go. So what is Chinese medicine most effective for? Or maybe just effective for, so we know?
So I want to say about traditional Chinese medicine, in many states they're considered primary healthcare practitioners, which means you don't have to go to your internist first.
I didn't know that.
You can go to your doctor of Chinese medicine, your acupuncturist and herbalist first, and many states require that insurance companies cover. In fact, many years ago, the California Board of Insurance insisted that it was illegal to differentiate between a medical doctor and a licensed acupuncturist for providing traditional Chinese medicine services, and insurance companies had to cover it. Okay,
and they still do?
I don't know. It's 35 years later. I don't live there anymore. I don't know how the laws have changed. I'm just telling you a little bit of the history. Okay, moving on to answer your question. So, everything from pain, musculoskeletal pain, the common cold, the flu, autoimmune disorders, digestive issues, big thing. Side effects of chemo and radiation if you're undergoing cancer treatment therapy. Additionally, fertility issues, super big one. In my office, I used to have a big bulletin board with all pictures of the babies. I used to call it the baby wall for the babies that were born who were helped with acupuncture and herbs with the mother. And that was a really joyful thing to have.
Wow, such a broad spectrum. I wish it were covered by health insurance.
Depends on the insurance company. Some insurance companies do cover it.
Oh, that's very interesting. Hopefully one day it's going to be more official in many states. According to the traditional Chinese medicine, what are the components of health? What does health consist of from the Chinese perspective?
In a very basic way, health is the ability to do everything you want to do in your life. It's being able to live your life, okay? But in traditional Chinese medicine, we break it down into what they call the three treasures. Mm-hmm. The three treasures are what we call Jing and Qi and Shen. Jing is everything representing that which we receive from our parents. Essentially the DNA, essentially our essence, but everything ruling growth, development, reproduction. This is all ruled by the Jing. A baby whose fontanelle doesn't close, or who isn't thriving, or isn't developing properly, or isn't growing, we would say has an issue with the Jing. Similarly, having low sperm counts is also a Jing issue, interestingly. We talk about Qi. A lot of people hear Qi thrown around New Age circles and holistic circles. And what happens is that they say in traditional Chinese medicine, in the ancient texts, it says human life depends upon Qi. And when the Qi is dispersed, then the body dies. So the difference between a cow in the field and a steak in the grocery store is Qi.
So
it's
to
life.
Translate into normal language would be Qi energy, right?
Qi is energy, but it's life.
Mm-hmm.
It moves.
Life force.
Life force. It moves, it warms, it defends, it holds, it transforms, is what we say. The third major component or treasure, which we say in traditional Chinese medicine, is Shen. Shen, in the texts, they used to say, Shen is what emits from your eyes when you are truly awake. It is your presence, your emotional life. It is our emotional strength. It is our spirit. It is a lot of things. If somebody looks very bright one day, you say, oh, you're so Jing Shen. You have such a bright Shen today.
So when someone comes to see you, in order to give a proper diagnosis, you have to look at all of these three angles of health, correct?
I look at those three angles of health. I evaluate the three angles of health, but I do it in a very physical way. Mm-hmm. Would you like me to describe?
Please. It's very fascinating.
Okay, so diagnosis in traditional Asian medicine is very interesting. We start by looking at the patient. What is the quality of their Shen? Are they subdued? Are they bright? Are they a little bit too bright, even, which is a thing? Then we ask them to show us their tongue. We look at the size of the tongue, the shape of the tongue, the color of the tongue, the coating of the tongue. All of these are diagnostic for us in traditional medicine. And in Western medicine, folk medicine from hundreds of years ago, not thousands, but hundreds, they looked at the patient and understood what they were looking at. They looked at a patient's tongue. You go to a Western medical doctor sometimes and he'll say, stick out your tongue, because that used to be a thing. Mm-hmm. It used to be a thing that they were trained in. Additionally, in traditional Asian medicine, we take a patient's pulses. So there are 3 pulse positions, superficial and deep, each on 2 hands. So that's 6 on each side, 12 positions, indicating the state of the 12 different major organs in the body. For example, we describe a pulse. Is it soft like wet cotton? Is it slippery like marbles in a wash basin? Is it thready like a thread? Is it thicker than a thread but kind of has a hard edge to it? That would be considered wiry like a piano wire or a guitar string. Additionally, we ask questions of the patient. For instance, we ask about their elimination, their hunger, their thirst, their sleep. These all tell us what is going on with their body.
I remember when I came to see you, you used terminology like "you're too damp." What is that supposed to mean when someone is too damp?
Well, we talk about a patient in terms of how moist they are or how dry they are, because this tells us something about their digestion. This tells us about the possibility for infection. If somebody has too much fluid in areas that there shouldn't be fluid and it's been sitting for a long time, we describe that as damp. And probably it sounds like poetry to our patients, but what it means to us, what we tell ourselves, is that we need to get that moving. We need to get that fluid moving.
Whatever it was, it worked. Your diagnosis worked, and consequently the treatment also. But Chinese diagnosis is very, very fascinating. It's very different from the Western diagnosis that depends on the blood work results and then advancement of the diagnostic machines and, of course, physical exam. But the principles are very different. What you're describing right now, Chinese medicine diagnosis, to some people may sound unscientific. But if we're looking at it, the Chinese medicine records date back to 5,000 years ago. One of the most ancient medical records ever. So there is some wisdom to it.
Well, they say that more people have been treated by traditional Asian medicine over the history of the world than any other type of medicine in the world.
Well, that says it all.
Yeah.
You are a wonderful acupuncturist. So I would like for you to tell us maybe a couple of case histories of your patients, maybe miracle recoveries like mine.
Well, so let me just say that not every recovery, not every treatment, not every patient has the kind of recovery that you would want to stand on a rooftop and shout to the world. Sure, when you're having trouble conceiving a baby and then you're able to have a child, this is amazing. It's really amazing. It's been amazing to just do a small modality on a patient's toes when she's 37 months pregnant, and her transverse baby will turn and become head down while you're sitting there. That is an amazing thing to observe. But even in small ways, the small quiet ways, when somebody is having trouble getting through the day because they're exhausted, and then they're able to complete their day and be productive and feel okay. If they have crippling migraines and suddenly those migraines are lessened and then they disappear, that's fabulous. It's fabulous when a patient who is undergoing chemo and radiation and they have no appetite and they're exhausted and they're having horrible digestive side effects, when suddenly they can look back on that period of time and say, okay, I went through chemo and it wasn't too bad. And those small ways are really, to me, very miraculous.
Yeah, even small details like that.
Yes.
Well, Chinese have achieved incredible success with using their herbs. I think they've used more than 2,000 types of different herbs, what we know as Chinese herbs. Can you talk more about Chinese herbs to us? I know they can be divided into different groups and this whole philosophy about them.
I would love to talk about them. I love Chinese herbs. Okay, so there are many different categories of Chinese herbs, and they are categorized according to what they do in the body. We have the diaphoretics. That is a really, really big word, which means the herbs that make you sweat.
Mm-hmm.
To bring out a pathogen when there is a specific set of signs and symptoms, and that's needed. There are digestive herbs, which help you digest, and there are specific signs and symptoms associated with that. There are strengthening herbs, herbs that strengthen the chi, as we talked about, make a person stronger. They will strengthen your blood if you're anemic. They will strengthen your yin, which is having to do with your body fluids, and they will strengthen your yang, which is also a specific set of patterns and symptoms. There are herbs that are anti-parasitic, which is a fabulous thing. There are herbs that are specific for moving blood. Those are the herbs that you would not use if a patient was on warfarin, Coumadin, Lovenox. There are herbs that move qi for patients that are under a lot of stress and their qi gets very stuck. There are herbs that cleanse fever, both like what we call a summer heat, which is sunstroke, and also pathogenic fever. It's really, it's fabulous. And in wintertime, of course, it's important to take warming herbs. And there are warming herbs.
Last time we spoke about it, and someone made a comment on Facebook that they like this idea about cold and hot herbs and foods at the same time, which is it's an interesting new concept to many people.
It is a new concept to many people, and yet it is one of the oldest concepts
in Chinese medicine.
In medicine.
In medicine. I remember us living in the former Soviet Union. I am from the Central Asia. Our grandparents, they used this terminology, food, warming food and then cooling food. I knew that from growing up, from my childhood.
See? It's wonderful.
Yeah, so, but here in the United States, for many people, that's a fairly new concept.
We're a fairly new country. People are divorced from the ancient ways.
But Chinese herbs, from my knowledge, can be boiled into tea, like different formulas, like we talked about last time. You can create different formulas, and that can be boiled into a tea, which is not, it takes time, it's smelly, and it's not great tasting. Versus Chinese herbs in the form of pills and tablets. So potency-wise, is one better than the other?
I would say yes. I would say if you have a kind of condition that you need a really, really strong effect for instance, fertility issues, if you have some sort of a blockage in your body like a kidney stone or a gallstone or something really big, some sort of tumor, then I would say, as inconvenient as it is, boiling up raw herbs into tea, drinking them, yes, they smell bad, yes, they taste bad, it's fine, it doesn't matter, it's medicine. However, people are very, very busy, and people are very busy, and people can't always wrap their head around boiling the Chinese herbs. So, because for this reason, there are capsules available, there are pills available, and my feeling is it is better to take the pills and the capsules than to take nothing.
Absolutely, I agree with you.
As long as you get them down, they're helping you.
I took the kind that needed to be boiled and strained and consumed 3 times a day and, be dealt with the taste of it, but it worked.
I used to have a teacher that used to tell his patients, "What? You don't like the taste of the Chinese herbs? You're the first person who's ever said that to me." But he was a horrible man who would just play with his patients' minds. But every single person hates the taste of Chinese herbs, even me. And yes, I have boiled them up and I have drunk them, and that is the way it is. Years ago, for my patients that were undergoing cancer treatment, I used to take the herbs that would strengthen their blood, and I would boil them with sweetener into lollipops.
Oh,
so
wow.
It would be easier for them to ingest the herbs to make them stronger.
Wow, you can be so creative with it. Boil them into lollipops.
Yeah.
Can Chinese herbs be harmful?
I would say the one Chinese herb that I would stay away from are the blood-moving herbs when a patient is on Coumadin, Lopinox, or we talked about warfarin.
Here's what I read on the website of National Cancer for Complementary and Integrative Health. Some Chinese herbal products have been contaminated with toxic compounds, heavy metals, pesticides, and microorganisms, and may have serious side effects. Can you comment on that?
I think when you're talking about people looking at the whole of Chinese herbal medicine and saying, well, all of these things some have this effect and some have this effect and some have these compounds. I don't know if people remember, but last time I said that Chinese herbs are specifically grouped into specific, very specific formulas for the sole purpose of how the herbs affect each other, because many herbs have a calming effect on other herbs, a moderating effect, so that whatever toxic effects might even part of it are then removed. I don't worry about it.
I see. Okay, good to know. Thank you. To get Chinese herbs, you have to go to a practitioner that understands this terminology, Chinese terminology, the names of these herbs and how they work. However, I believe there are Chinese herbs that are more or less common and known to general public. So we cannot leave our audience without any recipes or just, some common knowledge about Chinese herbs that can be used in their daily life. So can we talk about it?
Sure. Last time we spoke, I for sure talked about ginger, and I for sure talked about cinnamon, which you can cook with to have a warming effect on the body. And I also spoke about nutmeg. Those are actually all in the Chinese pharmacy. Now, a lot of people have heard about something called ginseng. Let's talk about ginseng, okay? Ginseng is not for the 25-year-old who wants to increase his quote-unquote sexual potency, whatever, because in a young person, a young adult, it can actually cause headaches. It can actually raise your blood pressure because it's not for that. Ginseng is considered a king herb. It is one of the strongest, most well-known herbs in the Chinese medical pharmacopoeia. It is for an older person who has problems with their blood, their strength. They're recovering from surgery. You're recovering from childbirth. You're really in a very weak state. Years and years ago, I think I had mentioned my father-in-law. He was recovering from his aortic aneurysm. He had no energy. He couldn't even speak. I gave him ginseng. 2 weeks later, he was playing singles tennis. Wow. It is specific for older people recovering from something or who have lessened stamina due to age. Okay. Next.
Before we move to the next one, where do you get it from and what form?
I would go to if I was my age and I was recovering from surgery, I would go to a health food store, a Chinese pharmacopoeia, and I could get it in tablet form. And that would be how I would do it. Or I would get the raw herbs from my pharmacy, from another practitioner's pharmacy. I would mix it with a couple other herbs to increase the positive effects of it and help also with nourishing my lungs, with nourishing my digestion, all sources of energy in our body from the air, from food. So I would do that, and I would boil it into formula and I would drink it. Now, I wouldn't take ginseng if you are under the age of 40. I just wouldn't. All right, now moving on, there's another herb, more for women, called dangquai. It's Chinese angelica. It is specific for strengthening the blood, for moving the blood, also for helping with a deficiency or dry type or depletion type of constipation. For women following childbirth, they make a soup with strong root vegetables. Sometimes they'll put in traditional Chinese medicine, we call it a black bone chicken, a specific kind of chicken that has black bones. and they put the dankwe, the herb, actually into the soup, and they boil it and they serve it to a woman recovering from childbirth. If you are a young woman and you have issues with your menstrual cycle, if you have any kind of cramping or a lot of, excuse me for saying this, but a lot of clots in your flow, this is an excellent, excellent herb for you, and you could take it almost in any form, and it's completely safe.
Where do you get the dankwe from?
I would get it many places. I could get it at a health food store. I could get it from my local Chinese medical practitioner. It's spelled either with a D, like DANG, GUI, or with a T, TANGKWEI, pinyin. You know, the way of writing Chinese with English letters it sometimes differs.
Any other ones?
I think that's a good start for people.
That's a good start.
A lot of this information is so much for people to wrap their head around a new way of thinking. I don't want to overwhelm, but just let that information sink in and start getting, putting your toes in a little at a time.
Yeah, I think I can agree with you. Would you like to say anything to our audience? Some words of wisdom.
Thank you for taking the time to watch our video. I appreciate it, and I hope this information isn't too overwhelming for you. Even doing small things in your day, like looking at the trees outside of your window, or sitting outside and enjoying the spring for 10 minutes, can dramatically change your health.
This was Leslie Koff, a licensed acupuncturist with over 35 years of experience. Thank you so much for watching. We'll see you next week. Goodbye.